Hello, this is Dr. De Silva. I'm the Medical Director at Kids and Teens Medical Group, and today is April 7th, 2020, and I'm here today to give you an update on COVID-19 or coronavirus. I haven't created a video for the past week or so because I've been quite busy, as you can tell, creating our own COVID-19 pandemic protocols for our practice and ensuring the safety of all of our patients as well as our staff and our medical staff. So it really has been very important for me to make sure that we follow public health guidelines, monitoring temperatures on both patients and staff, ensuring that we have personal protective equipment for all of our team, our medical team, as well as creating telehealth for all of our sick patients and giving resources to everyone. I hope that if you have any questions, you'll reach out to us through our Facebook page, Kids and Teens Medical Group, and you can comment there. You can message us anytime. We're also available round the clock, 7 days a week, on our homepage on our website, www.ktdoctor.com. So please feel free to reach out to me and to my team. And I want to thank everyone who has been involved in getting us to this level of giving you the services that your infants and young children need. So I want to start, as you know, I like to review the latest information through articles that are published online and give you those resources. And I will have that available for you once we post this on our Facebook page. The first article that was written today based on Governor Newsom's media speaking today is from the LA Times, and the title is "California has enough ventilators for now," Newsom says. Coronavirus peak not expected until May. So that's really positive that we have enough ventilators. And I want to just read this to you, and you can also feel free to read this when I post it on our Facebook page. Sacramento. Governor Gavin Newsom on Monday announced that California was lending 500 state-owned ventilators to the Strategic National Stockpile to help New York and other COVID-19 hotspots facing shortages of the desperately needed medical devices. And he goes on to say, you know, he wants to extend not only his thoughts and prayers, but we're also extending a hand of support with ventilators. And I'm going to go on through this article and just highlight some of the things that he says. And he explains how we have so many ventilators. But the really important part of this article and what he says is that later on, further down in the article, he says, one reason California can afford to spare ventilators, at least for now, is because the vast majority of Californians have heeded orders to stay at home, and when venturing outside to buy essentials or for recreation, have also maintained the recommended social distancing from others. If Californians maintain that behavior, California should have enough ventilators to care for those in need in the state for the near future, Newsom said. So this is really, really important, and I want to highlight that and thank everyone for following social distancing measures or physical distancing measures. And he did speak again today, and I will highlight some of the things that he said today, but I want to go back through and give you some more highlights from information that we've received in the news. The next article that I want to highlight is actually from KTLA. So that's one of our local news agencies, and the title of this one is, "Anyone in LA County with COVID-19 symptoms can now get tested," Mayor Garcetti says. And this is true. And I have looked into this, and it's quite true that now anyone who wants testing can. And I will post that as well. And you can also search online for LA COVID-19 testing, and you will be able to get a link to apply online for a test. And in this article, it says, Los Angeles Mayor Eric Garcetti announced Monday that the county is expanding testing for the novel coronavirus by removing restrictions on who can get tested. Any resident in the county can now apply for a test online, the mayor announced. later clarifying that people who need to have COVID-19 symptoms to actually get tested at one of the county's free drive-up testing sites, and they are all over Los Angeles County. So previously testing was quite restricted, and now I'm really grateful that we all have access to tests here in LA County. So please do look at that, and that resource, as I said, is easily available through a Google search. All right, let's see what else here we have. All right, so now the next thing I want to put up here is the County of Los Angeles Public Health. And we have the data, live data that goes into this site, and we can see the number of cases and deaths in Los Angeles County alone. So it says 6,910 cases with 169 deaths. And there's reporting for every city that you can find online. So that's all important and good information. And I think we're progressing really well. I see a lot of people online taking all the safety measures, using physical distancing, as well as using protective measures when they are out shopping and things like that. Now, the next part I really want to focus on in an interview that Governor Newsom gave today on NPR. One of the things that he highlighted is what's really important to him and is also important to me is mental health of our community. And I did post some of that information earlier, and I want to just remind you that there are resources online, and I will definitely put that up on my Facebook page as well, that the Los Angeles County as well as the CDC, if you Google search mental health CDC COVID-19, you will find the resources for a lot of information and assistance that is free, and it's free through a lot of 800 numbers and hotlines that you can call. And right now, so in the Los Angeles County Mental Health, they have a 24/7 access line to help with anyone who's having anxiety during this time, because we do understand how lonely and how desperate it can get when you are, practicing physical distancing and staying home during quarantine. I use that word. I know that you are not in quarantine if you're just focusing on stay-at-home orders or following stay-at-home orders, but it is loosely, I'm using that term quarantine, that I want you all to stay home during this period. So all of those resources, there's like over 10, 15, 19 resources for you to look at. And this is really important as you stay at home if there are problems at home, if there are problems, and I've spoken about this previously about with drugs and alcohol or severe depression, that I do want you to please reach out to one of these numbers, one of the hotlines. There's suicide prevention hotline as well to call. Everyone's going through this. If you need help, please reach out to those numbers. And then the next part that I really wanted to talk to all of my parents, because I know that that the people that I really want to talk to here are the moms and dads with little children who are now stuck at home teaching them. And I want you to know that we are still here to support you. We have telemedicine 7 days a week with a pediatrician. So please do give us a call if there are concerns or questions. You can message us through as well through the portal. But one of the important things that I want to focus on in terms of mental health and COVID-19 and stay-at-home orders is the importance of your child's safety, not only physically, but also in their mind. And one of the things is that is important to me is to help you understand that calming your child's brain during this time is really important. And one of the most important ways to stay calm is to really stay away from a lot of media, the media hype, the media news, because if we watch too much of that, that can really cause our brains and our minds to overreact. And what I want to help you today is to help you to stay calm during this time by not watching the news. Just a simple measure of not watching the news. And also, one of the things that I try to teach our parents when they come in, if your child is breathing fast or seems anxious is to slow down and focus on breathing. So there are lots of resources available online now for meditation, for yoga, calming music, and other things that can help. And a child's emotional intelligence is really important. So it's important that our children have, go to their classes online and learn and all of that. But it's equally as important that we work on spending quality time and also helping them to calm their brain and their mind. Because research and studies show that if we teach our children during this critical time and during these years, their brains are developing rapidly, but they're also very able to learn these types of skills. It's not that we as adults can't learn, and we can definitely learn. If we feel anxious, we can talk to a therapist or a professional to help us. But if we can teach our children at this time to learn to slow down and calm down and focus on the breathing, it's something as simple as counting through the breath and through the breathing in, counting about 7 to 8 seconds, and you can count for your child and just work through a simple exercise like that. So think of going through breathing exercises as something really important right now, just to practice, as that's the mental exercise that you can do. Not only if you notice that your child is going through something like that, if of course, if you notice that your child is breathing fast or anxious, then definitely help them to calm down. But I've used this also with a lot of our asthma or respiratory patients, especially during this time. I have talked to them about slowing their breath and counting the seconds that it takes to breathe in, hold the breath, and then count out as you breathe out. So if you're counting 7 to breathe in, try to count another 7 as you hold the breath, and try to count a little bit longer than 7, maybe 10 to 14 as you breathe out. So do that exercise if you can with your child. Your child will be so happy to try that out with you. If you have any questions, please let me know. This is Dr. Jan at Kids and Teens Medical Group. Have a wonderful day. Till next time.